married between the two research areas. So please, okay, research speed dating. My name is Odoabong Otu, and we'll be taking this. In case you don't know what, in case you've never heard of it before, it's very simple. It's a fast-paced academic networking strategy that helps researchers quickly identify shared interests. Take it back, please. And potential collaborations. So that's what we'll be doing. I know we've done this before. Yesterday we had the opportunity of introducing ourselves, but this time around we will do it deliberately and be very intentional. So someone is talking about it, he's ourselves, and then you get to hear, this person is in. I've been having this idea about this area. Okay, I can, that's collaboration. Okay, just take note of the person. Can we work on this after now? And so please, both for the online participant and the in-house participant, we'll be introducing ourselves. Don't just give us your name, but please tell us. Sorry about that, please. Tell us your research area. Tell us your research interest, your research area, who you would possibly love to collaborate with, and why, and what you are working on currently. So the objective of research speed dating includes building professional networks, finding interdisciplinary collaborators, sharing research ideas, identifying mentors or supervisors, developing grant proposals, discovering complementary research expertise, encouraging innovation through cross-disciplinary conversation. We are talking, and then someone in, let's say, education is talking with someone in management, and all of a sudden there is a spark. Oh, we can actually work on this next. We can actually work on this, and then that's how the idea starts. And we start developing it. Before you know, literature reviews is coming up. Before you know, research questions are being asked, and we are getting to the point of data gathering. Okay, where can we go? Who can we meet? Who can we talk to? Benefit of research speed dating. Research speed dating offers several advantages. Efficient networking, very important. Interdisciplinary collaboration, the same thing. Communication skills. This one here, when you are speaking with someone in the medicine, people always say medical doctors have the worst of handwriting. I don't know, doctor, I don't know if that's true or wrong. But if they write, you will not understand. You will not even see it. But when they hand over that paper to a colleague, they will just look at it and then they will understand. But me, as a common man that I am, I can't understand. So communication skill, it will help you to communicate with someone who is not in your discipline in the lowest possible way that the person can understand. So it helps build communication skill among researchers. If a medical doctor is talking to a medical doctor, they know how to talk, and then, okay, like this morning, Dr. Reda was talking, who was I talking to? I didn't even understand what she was saying. There's injection, there's adjection, like, I don't know, they claiming. Tell me that you have eaten or the food has gotten into your stomach and it has gone out, you've used the restroom, you've sent it out. Don't speak those big jargon because I don't understand. Now, that's what communication skill will do. Career development and funding opportunities. These are some of the benefits of research speed dating, where you will say, Dr. Gospel will say, okay, there is a funding opportunity like this here, and then you will now say, let's work together. That's because you were able to communicate with this person and at some point found out that, okay, we can align in the area of research. So questions for discussion. I told it was going to be very fast. Online participant, please, can you hear me? I need someone to say something, please.
Yes, we can hear you, sir.
Okay, so we'll start from our online.
Yes, I can hear.
Hello?
Loud and clear.
Thank you very much, Tolu. Before we have the in-house participants do the normal introduction, we'll have the online participant do the introduction. You just tell us your name, your research area, your research interest, and then I don't know if you can see the slides.
Yes, clearly.
Okay, so I don't know who would like to start. Tolu, are you there?
Let me start, please.
Oh,
Okay.
Sakpolo, please, thank you. Start.
My name is Dr. Sakpolo Igbinovia. I'm from the Department of Modern Languages in Ambrosali University, Ekpoma, here in Edo State, Nigeria. And my current research area is about inclusivity and gender studies in translation studies. The research method I'm using is a mixed method actually. I'm using both empirical figures and then qualitative and extensive textual analysis. The challenges that I would love to solve using this research, I'm not very good with empirical analysis, that is quantitative analysis. So I would love to have more understanding and more, we call it matrice. I don't know the word now for it in English, sorry. Anyway, more knowledge about that quantitative research method to be able to use in this, my current research. And the type of collaboration and expertise I'm looking for are actually people who can use this computational thing, you understand, to interpret data for me. And now someone else research can complement mine if that person has a knowledge of Ngram, how to read codes, how to read what's it called, graphs and all that, because I'm a arts and humanities person, so I'm not very good in that area. So, and I'm open for collaboration. Yes, I'm open for collaboration. Thank you so much.
Okay, thank you. Please, Tolu, are you still there?
Yes, I'm still in. Thank you very much. My name is Tolulokpe Iredele. I'm a postgraduate student. I'm on my PhD currently at the University of Lagos, Department of English. My current research is on digital humanities, which is very, very aligned to the studies and interdisciplinary study. I'm working on female health public advocacy on social media. So it's an interdisciplinary study on its own, on medical communication, and also on the digital platform. I've been able to work with Voyant and Langsbergs. My research method is actually majorly quantitative, generating quantitative data from qualitative data. So it's been a journey. So, and then all that is a mixed method, basically. So then my research challenges, what challenges I would like to solve using this research is one of my objectives. When it comes to medical communication, health conversation, there are 6 domains I work with: female-based violence and abuses, female genital mutilation, maternal care, the SDGs 3 and 5, basically. So it's what I've been able to elaborate into 6 domains. So the challenge I have is how to prefer social solutions through computational methods and profiling an app that will help medical experts, particularly those in public health and counselors, to measure pain, that transition of pain to trauma using discourse, language. So I've seen it work with in the UK, and I want to implement it in Africa. I've seen it work in the UK, and we can discuss further on that. I want a domestic tool that we can use. Then the collaborators and expertise are like those, anyone who can help with app development, coding into different languages, because we're also looking at multimodality, having it duplicated, having it in different language forms that will be accessible to individuals. And basically that's the top. Then how someone else's research, anyone in public health can come in, anyone in that is very vast with app development, with coding and transitioning of all these things, the back end, the loop and all that will be very, very fantastic for it. Then am I open for collaboration? Of course, yes, 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 and yes. Thank you.
Thank you very much, Tolu. Mr. Emmanuel, please, are you there? Mr. Emmanuel, please, are you there? Okay. Oga Hillary. Yeah. Mr. Emmanuel, please, are you here? Can you say something?
Hello, yes, I'm here.
Okay,
Good
please, over to you.
afternoon.
Good
Good
afternoon.
afternoon, everyone. Thank you very much, sir. All right, I'm Emmanuel Elikling. I just put in for my PhD in University of Ilorin, PhD in accounting. I'm still waiting to be admitted, but I've been interviewed already.
Huh?
Hello, can you hear me?
Okay, yes, we can hear you now. Please, can you go all over again?
Okay. All right, so my name is Emmanuel Elikling. I just put in for my PhD in accounting in University of Ilorin. So I'm still waiting to be admitted. But what I intend to work on is the effect of the new tax law. Okay, how companies, because there are several issues around it, how companies are responding to it, trying to put in several measures to help them avoid tax legally. Okay, so I'm still building on that anyway, but one of the challenge with that is that can you still hear me?
Yes, we can hear you loud and clear. Please continue.
Okay. Yeah, so one of the current challenge with that is that since it's a new tax law, there is no much information yet. Okay, and then my program is just for 3 years. So even within that period, I'm not going to have enough data to work with. So I'm still at that point trying to review the research focus to see how best I can work on it. So that is the point I am at the moment. I'm also open for collaboration on how best to navigate that challenge. Thank you very much.
Okay, so if he comes back and then hear him, we'll continue. Okay, so please, back to the in-house participants. I'll start with my doctor, sir. Please. The questions are just Prof, sorry. Sorry, Prof. Please just run through them and
Well, I don't know if I'll be able to go through all one by one as it is anyway. I'm an associate professor, a reader, like some of you know, most of you know. I'm from the University of York, and I've said before, I've been with the university since 2015. Well, okay, fine. What really bothers me, even when I became a medical student and finished, I did my postgraduate and then became a doctor. It didn't bother me much till I started practicing in the field where I find myself, hematology. Well, hematology is a field that deals with the treatment of blood and blood-related diseases. And every now and then, you get to a point you're so depressed when you see patients coming to you and there's really nothing you can do. If some of you had noticed in the morning, before I even came here, I had a lecture with my students from 9 to 10. That's why I came in late. And today is my clinic day. So as I was sitting here, my residents were calling me from time to time. I'm the head of department, and I've been the head of department for 8 years. And also the vice dean of the Faculty of Basic Clinical Science at the College of Health Science. So my resident was calling me up and down, telling me about patients I came to clinic. And many of them were in very terrible states. And the one that really disturbs me is the cancer. Cancer is really a problem. And one particular aspect of cancer that many people don't know about is blood cancer. And most of the cases occur in children, where you have the leukemias. The sad reality is that leukemias, lymphomas, multiple, all the blood cancers are incurable. They are incurable. So even as sometimes as a parent, when you look at maybe your child has a fever and all that. I remember when my child, many of my children, or my cousins, or my nephews, or any of them have fever, children. Begin to wonder, it's not just fever. You as a doctor will want to examine them fully and make sure there are no lumps anywhere in the body. That the liver being enlarged, the spleen being enlarged, and particularly the lymph being enlarged. If those things are not there, you run a test and go through, look at the peripheral blood film, and then when you look at the film, even before you do that, you start having butterflies in your stomach before you begin to look at those things. I look at that once, I'm sure it's not leukemia. Because the truth of the matter is that even when people tell you bone marrow transplant is going to solve the problem, it's not going to solve the problem. And very few people have the resource, financial resources, to do a bone marrow. When people have these leukemias, even as doctors, medical practitioners, won't tell you that there's no hope. We'll try our level best and count on God and all that. Many of them, especially with acute leukemias, don't live beyond 1 or 2 months. They die. And there are many cases that people don't know about these cancers. That's why that sparked an interest in me to look at cancers. What can we do about cancers? And then again, some of the risk factors to cancers are even around us. We live in a place close to a telecommunication mast. It's a red flag. Close to a radio convention mast, or you go pass through the high tension wire every day. And then again, I have many patients that come from all companies. If you have, for instance, 100 or 200 people going to work, out of that 100, I come down with leukemia, blood cancer. So my research interest is in cancer, not just cancers, blood cancers, leukemias, and all that. I've done some work in it on these cancers. So I'm open to collaboration. Well, this particular time I might be a bit bad, but what role the other people what role they will play. For instance, maybe people in the medical field, like medical laboratory scientists, also have a role to play, and the pharmacists. Because some of the drugs now, when you look at drugs, there are drugs that you can give to the patient, what we call cancer chemotherapy drugs. Okay, these are drugs that when you give to the patient, it might solve the problem, it might target the cancer cells and destroy it. It's not going to stay in normal tissues. And in the process, that's why when even sometimes my hesitant about starting the medications, like radiotherapy, they say a lot about radiotherapy. Say, oh, you radiotherapy, you have cancer chemotherapy. But believe you me, I've been in the practice. I from medical school in 2003. So I've been in medical field, I've been practicing since then. I've noticed 2003. And then you begin to wonder, once you give this cancer chemotherapy, it accelerates their death. But nobody wants to talk about this. Okay? So what people are trying to do now around the across the globe is to look at molecular targeted therapies that will just target the cell. At the same time, you have some problems on your hands, problems that as you are cleaning, the person will need blood. And you're giving blood to the point that the body doesn't respond anymore. And that's what accounts is what's possible for the dead in most cases. So I'm interested in cancer research, which I begin even sometimes I have sleepless nights thinking about it. Just like HIV, I'm trying to find what cancer cells, no cancers. There's a place like there's no light at the end of the tunnel. So collaboration. So but I know my social scientists from what I've learned here will have roles to play, very pivotal roles to play. They can also come, we have a round table discussion and all of that. I know they can really help in collaborating.
Thank you very much, bro. That's nice. I'm a social scientist and I'm also interested in that particular study.
So if you need people, I'm one of the team members, sir.
Good afternoon, everyone. My name is Dr. Bianca Uzamaka Mbonwa-Dibe from the Department of Science Education, University of Nigeria, Nsukka. My current research is all about educational technology, technology in teaching, technology in learning. Hold on, I put it down. Context-aware artificial intelligence or digital technology or emerging technology tools. I am interested in building, bridging gender bias through AI integration. I'm interested in closing up the gender divide in technology in education, whether it is in STEM or in arts. I am also doing something on AI literacy and digital governance. I am very interested in solving some social issues using artificial intelligence tools. So I am in science education, I am an academic, but I think I have niched down in technology. What I use mostly quantitative research methods, but I have started doing mixed methods. I'm not very conversant with them. At least I don't know how to use NVivo to transcribe, do thematic analysis yet. So these are some of the challenges that I would like to solve. If I can find collaborators who are experts in any of these things I've mentioned, emerging tech, educational technology, how I can transcribe, interviews, how I can do thematic analysis, and all that. Anybody that is very conversant with mixed methods research, looking to collaborate with the person. So that is how your research would complement mine. Apart from that, if you are in English language, if you're in languages like Dr. Savono and Associate Dr. Tolulode, I think we can also collaborate because you are in digital humanities and you're looking at something, public advocacy on social media. We'll find a way to complement each other. So yes, I am very open to collaboration. Thank you.
Thank you very much, Dr. Bianca. Please,
That's noted, Dr. Bianca.
Yeah, thank you very much. She says thank you.
Okay, I'm Gospel Ebari. I'm a political scientist, a social scientist with the Department of Political Science at the University of Port Harcourt, the unique and only unique university in Nigeria. Currently, my research has been focused on I've delved into indigenous knowledge systems. So I've been investigating about indigenous economies, particularly with respect to the legacy or impact of oil exploration and exploitation within the Niger Delta and other resource-based environments, but with special focus on the Niger Delta. I also have been working on looking at the Nigerian reality with insecurity. So I've been working lately on trying to trace how the granting of amnesty in the Niger Delta could be argued to have been the reason or to have been what have legitimized violent extremism across Nigeria, specifically in the northern part, as this has created room for others to try to ask some of those. In terms of research method, I'm somewhat the opposite of Dr. Mbonwa Adigwe, right? Yeah, I am more of a qualitative person. Yeah, I've done a few mixed
approach, but I'm more qualitative. And my biggest catch throughout for the 2 days now, and even before I came, because I've been trying to see how to transition into quantitative, and so maybe just as a help, in vivo university to pay, maybe you should enough, it gives you all that people can do, and that's without you fly very high. So I want to do quantitative. I've done a few quantitatives though, but I want to do big data. I want to be strong enough with regression and all our digressions, right? So that's in terms of method. Then in terms of challenges I look forward to, I like seeing myself as being in many parts, trying not to be a mainstream political scientist, but to be a core social scientist that moves around, yet not losing foundation. So I'm interested in environmental politics, oil exploration, all the issues around the environment, climate change. In fact, my PhD thesis was on climate change and food security. And I think climate change presents an opportunity for collaboration because I can speak from the political or economic aspect, where someone is speaking from maybe the medical side. So that for me presents an opportunity for great collaboration amongst us. I'm interested in also looking at social problems such as social ills like drug abuse, core issues that we are dealing with, drug abuse, advanced fee fraud, prostitution, advanced fee fraud, Yahoo specifically. These are issues that are drinking into our nation, young people trying to see school as a scam as a result of this. So there are many sides to which we can look at this. I'm interested in collaboration along that line around the issues of inequality, which is also multidimensional or multidisciplinary, can be seen from a multidisciplinary perspective to inequality and poverty. Then my core area, I don't know if there's any political scientists, elections and democracy. I'm also very interested in issues around AI, generative AI, its impact on education. I think basically for learns is that we learn daily. So I believe people know better than me. I'm willing to learn. So if you're good with quantitative, I'm also open to collaborate. And I'm not fixed on having someone necessarily from my discipline. I'm open to cross-fertilize. Even if you're from engineering, I believe somewhere we could meet. Let's meet where we can meet. Then in terms of collaboration, of course, the answer has been yes from the very beginning. And I'm looking forward to not one, but many collaborations from here. Thank you.
Thank you very much, Dr. Gospel. Okay, Dr. Sammy, it's just going to be very short. Thank you. Hello, everyone. Hello, everyone. So my name is Samuel Mbok. A pharmacist by training, a therapist by passion. I'm from the University of Uyo. Recently completed my master's program in clinical and biopharmacy, where I delve into prostate cancer. So, Chief, we relate. What I did was to find out the peculiar demographics around prostate cancer, the pattern of presentation, and then the management outcome, which is very, very important. And what I saw was, just like my chief said, was something to, savor and also ponder about. And that brought me to a research interest that I've been sleeping over recently, which is computational oncology. And computational oncology is, the intersection between computation, medicine, pharmacy, and social sciences. So it's about creating machine, learning models that will help, first off, predict drug response. This, drug response, and then that will tell us, okay, don't give this drug to this patient. The likely response will not be too okay. So by mining multiple data to predict drug responsive, segment tumors in scans, and then also discover biomarkers that we can. Is a lot. I don't want to go into that, but we are open. I'm open to collaboration. And then there is what he said that struck my interest, which is very, very important. Going around the research area of trying to create awareness of people, like Chief you said, awareness of people, their sense of perception, knowledge about these, different types of cancer. Because whatever the society does not know, it is what is killing them gradually. Right? Some of them may have this cancer, maybe the blood cancer, and don't know, only to arrive at the hospital when they are almost close to their grave. So I'm open to social scientists, I'm open to machine learning engineers. Example, George. me and you. And also I'm open to education people, because people need to we need to, create researches, make findings that will help people come to the realization of these things exist and they happen, both to the rich and the poor. How do we create models, whether it is AI models or apps that will help, help people to be saying, okay, if I have this kind of problem, this is the first thing that I'm going to do, and all of that. And also, by the grace of God, I'm good with the computation, so I'm open to everyone here. So if you want, I'll be on your team. If you want us to deal with an R or Python and all of that, I'm open. Thank you very much. Thank you, sir.
Okay, Dr. Samuel, thank you.
Good evening, everyone. My name is Yemisi Popola from Obafemi Awolowo University. So during my undergraduate, I worked on the factors influencing. I worked on factors influencing the non-utilization of health facility for delivery. So my research area, I'm interested in working on research about public health, particularly health inequality. I'm interested in working on factors influencing the quality of care given to women in the hospital during antenatal care and delivery. I'm also interested in working on research around sexual and reproductive health and rights, particularly as related to health misinformation. Okay, yeah, this one is under the first research area I mentioned. So I'm interested in how social networks and community norms shape women's decision on using health facility, using place of delivery, and how computational methods can be used to identify key influencers and patterns in maternal health seeking behavior. Also, I'm interested in research around artificial intelligence.
Thank you. Benson and Memobong is my name. I've mentioned earlier I'm a PhD candidate, specifically studying demography with specific focus on demographic health. And my major research interests has always been in health inequalities. So I always have done a lot of works, collaborative works though, on women with disabilities. Now, it is without fact, without fail rather, that a lot of women with disabilities do not have equal access to maternal health services, specifically antenatal care, delivery services, and postnatal care. We've discussed and found a few of them within our town and beyond. So one major problem we have is reaching out to these people. And then we need a large amount of data sets as much as possible. Now, I was always of the interest that if we have data-related information to these people, and then computational sciences can help us do a lot of collection, even within and without our area here, and that will be very helpful. So with that, I'm very much open to collaboration, not only within the social sciences, say, but also using methods that will be more authentic and then could produce more reliable results. So I'm more or less very open to collaborate with people from even in education, in the health area, where they can also link us to these women with disabilities. It could help boost our database and also offer a lot of recommendations in this regard. Thank you.
Okay, thank you very much, Mr. Fancy. Okay, so hopefully it's the last one. Okay, thank you very much, everyone. Online people, hope you can still hear us. So we've all had our research interest, and then we all know where we are, and then possible area of collaboration. But these are just very few areas. This is health, and let me say this because we are out of time. The kind of research that we'll be doing this in this particular cohort is not effect of rice on beans, where you can use regression, you use correlation. No, we'll be using computational tools. That's the essence for this course. We're using computational tools, and our data set will come from Wikimedia, right? All right, all the Wikimedia. So it's not that's where the data set will come from. That's why they are partnering with us this year. So please, these are just very few examples of. I heard you mentioned about environment and everything. You have interest. The Prof talked about health. He has interest in health. These are just about 7 different areas. We have food security, cyber security, technology, conflict. Last the example, Ukraine and Russia war, US and Iran. We have natural disaster, earthquakes here and there. We just had flood, and in Calabar, just very close to us, it happened that a building collapsed, killed 4 children in the family. Like the man lost almost everything. So I mean, these are areas we can dive into and then see how to harvest data from Wikidata and use it to do our research, come out with very strong findings, and make very good policy recommendations. So please, after this particular session, what we will have is you just wake up one morning, probably tomorrow morning or next morning, and see yourself in a group on WhatsApp platform based on different groups. It's going to be 4 persons in a group, and then in that same group you have Dr. Austin, you have Dr. Juliet, you have Dr. Rhoda, and then you have myself as group members. So now our present day is for professional advice. He's more of the tech guy, and we always be there to support. If you want to get data from anywhere, Juliet, myself, we are there for research and other areas. Dr. Rhoda is also there. So please, it's for us to brainstorm and then come out with a very strong research topic in any of these areas that we can lay hands using Wikidata, because that's the data set we'll be using. and then we can now come up with a very strong concept note. The research will not end here, that I can tell you. But the idea is for us to start, when we go back to our respective locations, we continue until we get to that final point of having a research paper. Like Mrs. Juliet said, there is grants. When we are ready for publication, we can also say, okay, we are ready now. This is the work, and then we apply for the grant and the money is released, and then we publish. Our names are out there. So please, that's the essence for this. So we've all had we've had our different areas of interest, and then we all know people's strengths and weaknesses, and the pairing will be done, and then we'll just start working. You're free to have your individual group calls, you're free to have your individual group meetings. Just come up with something that is interdisciplinary, and then you catch the interest and the fancy of everybody in the group. Thank you very much. Online people, please, you also be part of the meeting. Thank you.